to today's video on physical activity and cancer. In this video, we'll be looking at the role of physical activity in the prevention of cancer and within each component of cancer care. In the UK, one person is diagnosed with cancer every 2 minutes, and this is on the rise. Cancer is the leading cause of death in the UK, accounting for 28.1% of all deaths in 2017. Nearly 40% of these deaths are preventable, and physical activity could play a major role in reducing this figure. Furthermore, supporting people to be physically active at each stage of their cancer journey can be of clinical benefit and improve their quality of life. Cancer incidence is related to levels of physical activity, and this table shows cancers for which there is strong evidence for the preventative role of physical activity as an independent risk factor. This includes colon and breast cancer, which are two of the most common cancers in the UK. The exact mechanism of this preventative effect is unknown, but it's thought that physical activity may directly protect against cancer through several biological mechanisms, including promoting healthier levels of circulating hormones as well as a healthy body weight. Pre-surgical physical activity, regardless of the type, may benefit cancer patients through positive effects on function and cardiorespiratory fitness, creating an increased tolerance to treatment. Systematic reviews show that prehabilitation exercise also improves functional walking capacity and reduces hospital stays. During the treatment of cancer, physical activity is aimed at maintaining functional ability and well-being. A comprehensive systematic review and meta-analysis of 26 randomised control trials compared exercise versus usual care during cancer treatment. Overall, there were improvements in quality of life, self-esteem, aerobic fitness, muscular strength and body composition, and reductions in anxiety and depression. Physical activity can also influence fatigue, one of the most common and distressing symptoms reported by patients with cancer. A vicious cycle can develop in which patients place an overemphasis on rest at the expense of adequate physical activity. Therefore, physical activity can play a crucial role in breaking this cycle by improving energy levels, helping with symptom control, and relieving side effects of treatment. After treatment, physical activity helps restore functional abilities, improve well-being, and overall quality of life for patients with cancer. As well as symptomatic benefit, physical activity confers a reduction in mortality in patients with established cancer. Risk reduction rates in mortality vary between studies and between types of cancer from around 15 to 67%. Physical activity can also prevent and manage chronic conditions in these patients. Although there is a small evidence base, physical activity is safe and effective even in patients with advanced stages of cancer. It helps preserve quality of life, walking ability and strength, and reduces severity of symptoms. Physical activity in patients with cancer can pose certain risks such as symptom exacerbation, infection, bone fractures and falls. Despite this, national bodies such as the British Association of Sport and Exercise Sciences highlight the importance of avoiding total inactivity for all cancer patients. Furthermore, patients should be encouraged to increase physical activity to recommended levels with appropriate caution and at an individual pace to minimise risks. For patients with cancer, physical activity is safe and can improve quality of life, severity of symptoms, and increase life expectancy. Thanks for watching. For further information, please see the links presented shortly. Remember, encouraging patients to be active can be as easy as ask, advise, act.